Hi, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert, and I'd like to say a few words about facelift. As you know, this is the most effective rejuvenation procedure that can make one look 10 or even 15 years younger. People typically start thinking about getting a facelift in their late 30s, early 40s. Now, of course, not everybody needs it, but those people who are troubled with those early signs of age like jowls or some skin laxity in the neck, they would be considered for mini lift at this point. Now, as the aging process continues, the jowls become heavier and the neck sagging becomes a little more advanced. So at this point, we are moving into a facelift territory, which is a bigger procedure than the mini facelift. There are different types of anesthesia we can use for a facelift. Now, typically it's either deep IV sedation when the person is completely out and doesn't remember anything, or it's a twilight anesthesia when we give some medication to keep them relaxed and comfortable and sleepy, but at the same time not completely out. We anesthetize the face with a numbing injection so the patient doesn't really feel much, but at the same time they would know that they do this procedure. Now, lighter forms of anesthesia are generally considered to be safer than heavy anesthesias, but the choice of the anesthesia for the procedure is ultimately up to a patient. Now, let's talk about the most scary thing, incisions. Unfortunately, we have to do it to perform a facelift since it's a surgical procedure, but we'll learn over the years, and we do facelifts over 100 years by now, we learned how to hide those incisions so they are not really visible. And we are going to start around the neck, so small incision is going to go right under the chin when everybody has a little crease, and this allows us to hide it there nicely, and we can take care of the neck laxity and do the liposuction through that incision. Now the next one, once we bring everything up, we are going to be removing some extra skin, and the incision for that is going to hide around the ear. It's going to go underneath this hair patch, around the ear, on the inside of the ear, on the back of this little cartilage called trachea, down in this wrinkle, and back up on the back side of the ear into the hairline. Now, when those incisions heal, when people look at you, they really should not be noticing that, and that's the goal of hiding them around the ear. Another very important thing for you to know is that all facelifts performed today are SMAS facelifts. SMAS is SMAS, submuscular aponeurotic system, is a layer under the skin that is very sturdy and not stretchable. And this is the part that we are actually lifting when we do the facelift. We put some stitches there, and then the skin on top, we just remove the extra without putting any tension. So it looks natural, and the incisions heal much better this way. Now, once the tightening is over, we remove the extra skin. We're putting some tiny stitches around the ears and then apply bandages. And bandages in my practice consist of putting the cotton around this area so everything feels soft, and then just putting a few bandages on top so everything feels comfortable. Now, we need to talk about recovery after the facelift because this is one of the biggest questions people ask. Typical recovery after a facelift takes from 1 to 2 weeks before one can go back to work, right? So it usually takes this time for the initial signs that the surgery was performed to fade away, so when you return to your normal social environment, people would not notice that you had something done. Now, of course, the full healing after the facelift can take 2, 3, or even 6 months sometimes, but most of that time, the healing is going to be primarily internal. So you would know that you're still not healed 100%, but other people really would not see that. This is Dr. Konstantin, and we were talking about facelift.